work as a consultant in the Department of Hematology, Haemato-oncology and Bone Marrow Transplant in Amrita Institute of Medical Sciences, Kochi, Kerala. So today we are here to discuss about lymphoma. Specifically, I would like to discuss about the signs and symptoms that a person would have if they were to have a lymphoma, and also the best modalities for the diagnosis of a lymphoma. So what is lymphoma? So lymphoma is basically a type of blood cancer that involves the lymphatic system. This is a vital component of our immune system, which carries this fluid called a lymph that carries all the foreign substances and toxic materials from all the tissues of the body. So when a person has lymphoma, the most common symptom that the person is going to exhibit will be the swellings. It is most commonly seen in the area of the neck, your armpit, the upper part of your thigh. Some patients can go on to develop this enlarged lymph nodes in their chest as well, or in their abdomen, which can produce some kind of abdomen discomfort, distension. And if it is the chest area, they might have some chest discomfort, breathing difficulty, and so on. Some patients with lymphoma can even have prolonged fever and excessive fatigue, low energy all the time, loss of appetite, loss of weight, and associated other symptoms. So otherwise, the lymphoma, as I said, it's like arises in our lymphatic system, which can cause disruption of the immune system as well, and can contribute to increased risk of infections in the individual. So rarely the lymphoma can go on to involve your brain. Sometimes it causes various skin problems. As such, like I told, the lymphoma is a type of blood cancer, and some patients can also involve their lymphomatous involvement of their bone marrow, which can lead to increased your hemoglobin can be reduced, your platelet count can reduce, which can contribute to increased bleeding manifestations. Sometimes your white cells can decrease, white cells can increase, which can cause increased infections as such. So how do you diagnose a lymphoma? Diagnosis of a lymphoma is most commonly through the excision of the involved lymph node. So this can be either removal of the lymph node from your neck, your armpit, or from the upper part of thigh, where it can be enlarged. So other times where the lymph node is there in your chest or abdomen, there can be something, a portion of the lymph node is involved, which is called a true cut biopsy. So biopsy is the most common modality that is usually used for the diagnosis of a lymphoma. And this biopsy tissue is then seen by the pathologist, and they would run additional test called an immunohistochemistry, otherwise called an IHC, to see what kind of lymphoma you have. There are many different varieties of lymphoma. They are broadly classified as a Hodgkin's lymphoma and a non-Hodgkin's lymphoma, otherwise called as NHL. So this can be either then a B-cell lymphoma or a T-cell lymphoma. The treatment options that is currently available and your response to treatment would vary depending on the type of lymphoma that you have. So it is very essential that you have an immunohistochemistry, that is an IHC performed to know the type of lymphoma. This usually takes about 5 to 7 days time for the report to be available, and the cost of this test will be around 15 to 20,000 normally. And once this is done, the next would be a staging of a lymphoma. And staging is usually done by means of a whole body scan that is called a PET scan. PET scan is available in most of the centers in our country, and that would cost around 20 to 25,000 rupees. A PET scan is very essential for the initial diagnosis and also for later on follow-up of your treatment as well. And in some cases, a PET scan is done in the first stage itself for to guide the best site from which a biopsy can be done. And usually staging of lymphoma will be done based on, so you have stage 1 to stage 4. Stage 1 is where you have the localized involvement of your lymph node. For example, it could be only involving your neck area or your armpit or only your chest or only your abdomen. A single area basically that is involved will be a stage 1. And stage 2 will be a 2-area involvement. For example, your neck and chest together or your neck and abdomen together. So that would be a stage 2. And stage 3 will be like basically your chest and abdomen. If both are involved together, they will be a stage 3. And stage 4 is where your lymphoma has involved your bone marrow, or it has spread to your lungs, or it has gone to your liver, or is involved your brain. So this would be a stage 4 lymphoma. So this is about the diagnosis of lymphoma. Once the diagnosis of a lymphoma is done, currently the treatment advances, the treatment options available in our country is so advanced that it's almost like approaching near cure rate, around 80 to 90% in case of early stages of lymphoma. Advanced stages of lymphoma, that is in stage 3 and stage 4, we are currently looking at a survival rate of 50 to 60%, and there are so many progresses currently being made, so that in near future we would expect much more increase in survival rates. Thank you.